Hi everybody, you're welcome back to my channel. You're welcome to today's episode of Health Talk with Dr. Chidax. How are you all doing? Hope you're fine. Okay, today I decided to come here and talk to the mothers. So my message today is specifically for the mothers. Mothers, how are you doing with your children? Hope all is well. So I really want to talk about in Igbo they call it afoeze. That's when a child is teething, is concurrently having diarrhea and vomiting. That's passage of loose stool and vomiting. Women call it, and mothers call it afoeze, and they try to associate it with teething. That's whenever a child is teething, the child must have vomiting and stooling. And I'm here as a qualified medical doctor as in clear that impression. That impression is wrong. There is nothing like afoeze. Teething is just a natural process, it's just a physiological process and does not cause any sickness. The only thing that has been noticed for some time that teething can cause is a slight rise in temperature. This is just because of the pain the child is feeling, the sensitivity of the gum and the discomfort that the child feels during teething. It can cause a slight rise in temperature, but not that so high temperature. It can cause just light rise in temperature. Okay, but for vomiting and stooling, there is no association between stooling and vomiting and teething. But I would give you like two reasons there is those coincidence. Okay, so the first reason is because normally after a child is born and is around 6 months, the child starts teething, and exactly around that 6 month, mothers wean their child exclusive breastfeeding, trying to introduce the normal meal for the child. Everything happened around that 6 months. Now the process of the child trying to adapt to the new development of transitioning from breastfeeding to meal, that process can cause the child to have stooling and vomiting. The stooling and vomiting is not because of any disease. The gastrointestinal system is trying to adapt to the new developments. That's the new kind of food you just started introducing to the child's body. So as a result of that, the child can come down with stooling and vomiting. Remember, I told you teething starts around 6 months, and mothers normally off exclusive breastfeeding to supplementary breastfeeding still around that 6 months. So there is bound to be those vomiting and stooling because of the body trying to adapt to the new development. So this is one of the reasons. It's not because of the teething. Now the second one is this: during teething, the child's gum is sensitive, they feel discomfort, and it feels like it's itchy, and the baby tries to pick anything he or she sees around them to put inside the mouth to help relieve that irritation on the gum. That is why it's always advisable, if you have a child that is teething, not only when a child is teething, if you have children around you, hygiene should be top notch. Hygiene around your children should be top notch, both the environment, where the child crawls and all that. It has to be optimal, so that whatever the child picks is not going to introduce any infection to the child. Now, when that child keeps picking and putting into the mouth in order to relieve that irritation, he along the line picks something infected, puts into the body, and starts having gastrointestinal infection, which presents at that vomiting and stooling. In that case, teething does not cause vomiting and stooling, but circumstances, the activities surrounding the teething can lead to vomiting and stooling. When you notice the child is vomiting and stooling, please don't take it as something unserious. Take that child, take care of that child. Like I said in my former video, remember your ORS. When you give your ORS and it still continues, watch for hours and it still continues, it still comes frequently, take that child to the hospital. You will do that child a lot better if you take that child to the hospital on time and doctors are able to do something to salvage the situation earlier before it goes bad. Thank you. I believe I've really given you an update. Please, teething does not cause stooling and vomiting, but circumstances surrounding teething can lead to stooling and vomiting, like I've just explained. Thank you for watching my video. I love you. Bye.